Welcome back to the Healthcare Nurses Network podcast, where nurses connect, communicate, and collaborate to transform patient care. This is episode 4 of our 10-part series on case management, and today, we are asking an important question: are we settling for average in patient care? As nurses, we dedicate ourselves to providing the best care possible, but too often, we face fragmented systems, rushed discharges, and avoidable readmissions. Outstanding patient care is more than just treating symptoms. It is about coordinating every step of a patient's journey, ensuring continuity, and bridging the gaps that often go unnoticed. Case management is the key to making this happen. It is not just for case managers, it is a nursing strategy that empowers every nurse to improve patient care, reduce complications, and create a more efficient healthcare system. In this episode, our hosts, James Carter, BSN, RN, an ICU nurse, and Emily Ramirez, MSN, RN, a nurse manager, will discuss why case management is essential for delivering high-quality patient care, how nurses can extend their impact beyond the bedside, the role of case management in reducing readmissions and improving care transitions, practical strategies to identify and address gaps in patient care. They will also explore insights from Dr. Nicholas Abella's article on how case management elevates nursing practice and improves patient and healthcare team outcomes. And as always, we will leave you with an actionable takeaway: start a pilot project involving follow-up calls for recently discharged patients. Better patient care starts with better coordination. Let's explore how nurses can lead the way.
Welcome back to the Healthcare Nurses Network podcast. We're all about giving you the tools you need to not just survive, but really thrive out there in the nursing world.
Absolutely.
And today, we are diving deep into something that's, I think, close to every nurse's heart: elevating patient care through case management.
Yeah.
You might be thinking, case management, that's for case managers, right?
Yeah.
But here's the thing. The principles of case management can be woven into any nursing role. Bedside care, leadership, you name it.
Absolutely. And what's so fascinating about case management is that it really challenges how we traditionally define quality care.
Okay, I like that. Let's unpack that a little bit.
So, think about it. Quality care should be about creating these individualized plans for patients, making sure that there's continuity across their entire journey, and really being proactive about preventing any complications instead of just reacting to them.
I see that. It's so much more than just treating those symptoms in the moment.
Exactly.
So let's paint a picture for our listeners. Imagine a patient on a busy medical surgical floor, and they're discharged without a real comprehensive care plan. They probably feel lost, confused about their meds, not really sure what's next. But picture this: a patient whose discharge is guided by case management principles. They've got clear instructions, follow-up appointments already set, and a nurse who's checking in on them, making sure they understand everything and they feel supported.
Right. And it's that support that really makes a world of difference. Studies have shown that hospitals that have really strong case management programs, they see a significant reduction in readmission rates, sometimes even up to 15%, and of course, increased patient satisfaction.
Wow, 15%. That is huge. It seems like case management is really that bridge between the hospital and the patient's life at home.
It is. It bridges that gap between acute care and, getting that patient on their path to recovery and well-being.
Absolutely. Speaking of bridging gaps, I know a lot of nurses are probably thinking, okay, how do I add this to my already crazy routine? It can feel a little daunting, especially when we're already juggling so many patients and a million tasks.
Yeah, and that's why I think it's so important to think about reframing how we think about case management. It's not about adding more to your plate. It's about working smarter, not harder. It's about finding ways to weave these principles into your existing workflow.
That makes it seem so much more manageable.
Right, exactly. And even small steps can make a really big difference. So, for example, imagine a bedside nurse. They take a few minutes to make sure a patient truly understands their discharge instructions. Or a nurse leader who decides to implement multidisciplinary rounds. That creates a more collaborative and patient-centered environment.
And then that impact just ripples out from there. It helps not just that one patient, but it could prevent readmissions and complications down the line. And speaking of resources, I want to remind everyone to visit healthcarenurses.net. You'll find so many free resources to help support you on this journey. checklists, guides, templates, even information on those all-important TJC and CMS standards.
Yes.
Now let's dive into a specific example here. Our sources highlight a situation where we have a patient on a medical surgical floor being discharged. Two scenarios,
Yeah.
one with case management, one without.
Okay.
So in that first scenario, without case management, the patient might get some basic discharge instructions, but nobody's really looking at that bigger picture, their home environment, their support system, any challenges they might face. And what can happen? Well, confusion medication errors, missed appointments, and then, those dreaded readmissions. We end up just reacting to problems instead of being proactive in preventing them.
Almost like setting them up for failure in a way. Yeah, you could say that. Now, in the second scenario, we're using case management principles. So we approach the discharge process proactively. We're identifying obstacles before they even come up. We make sure the patient really understands their medications and their treatment plan. And we're connecting them with community resources. It's all about setting them up for success.
I love that. I'm curious about follow-up calls, because our sources really emphasize how important those are after discharge. But I know some nurses might be thinking, wasn't that the case manager's job? How do we navigate that?
That's such a great question, and it really points to a bigger issue we need to think about, changing our mindset about patient care. It doesn't stop when they walk out that door. True quality care means we're with them on the whole journey, from admission to recovery.
So even if my facility doesn't have, a dedicated case manager, I can still embrace this idea of continued support for my patients.
Absolutely, and think about the long-term benefits. Imagine a nurse in a rural setting, and they take the initiative to coordinate with local clinics and pharmacies to make sure their diabetic patient can get their meds and follow-up care. These acts of coordination, they may seem small, but they can prevent big complications and save time and resources down the line.
It's about seeing the potential in every single interaction.
Exactly, and that's what's so empowering about case management. It's not just checking off boxes, it's about advocating for our patients and making a real difference.
We've covered a lot of ground, but I feel like we've just scratched the surface. Don't worry, listeners. We are going to dive even deeper into the how-to of case management in part 2. We'll talk about strategies for actually putting this into practice, addressing those potential obstacles that come up, and sharing some really inspiring examples of case management in action. But before we move on, quick reminder to visit healthcarenurses.net for all those resources we talked about and so much more. Stay tuned. We'll be right back. Welcome back to the Healthcare Nurses Network podcast. Let's shift gears a little bit and talk about the more practical side of case management. How do we actually take these principles and put them into practice every day? I'd love to hear some real-world strategies.
Yeah, absolutely. So a really powerful strategy, even if you don't have a dedicated case manager, is to use what we call warm handoffs. It's such a simple concept, but it's incredibly effective.
Warm handoffs. Okay, tell me more.
So imagine you're discharging a patient who just had a recent fall. Instead of just handing them a bunch of papers, a warm handoff means you actually introduce them to a community health worker, or maybe a representative from a fall prevention program.
I love that. It makes them feel like they have that continued support even after they leave the hospital.
Exactly. That feeling of, hey, I'm not alone in this is so important. And it doesn't have to be just community resources. You can also do warm handoffs to specialized nurses within the hospital.
Oh, that makes sense, like a diabetes educator or someone from wound care.
Exactly. It's all about anticipating what their needs might be and being proactive about connecting them with the right people.
What about nurse leaders? How can they really create a culture of case management on their units?
One way is to really champion the use of data dashboards. These dashboards can track all sorts of key metrics that are related to case management. Things like readmission rates, patient satisfaction scores, even cost savings.
So it's about making the impact of case management really visible.
Exactly. When you can show everyone the tangible benefits of case management, using real data, it makes it much easier to advocate for the resources and the support you need.
And it probably helps highlight areas where you need to improve, too.
Oh, for sure. Data dashboards can help you spot trends, figure out where there might be gaps in care, and refine your strategies over time.
It's that continuous improvement.
Right. Always trying to do better for our patients. Another great tool for nurse leaders is to implement huddles or briefings, specifically focused on case management.
So not just your typical shift change huddle, but one where you're really focusing on patient transitions and potential issues.
Exactly. These focused huddles give everyone a chance to collaborate. Nurses, physicians, social workers, the whole care team. It's all about proactive problem solving.
It's amazing how even small changes in the way we communicate can have a big impact on patient care.
And that's what I love about case management. It's not about these massive overhauls. It's about finding ways to weave these principles into what we're already doing every day.
We've talked about all the benefits, but I'm wondering about the challenges. What kind of pushback might nurses get when they try to implement these ideas?
Yeah, that's a good point. I think one of the biggest obstacles is the feeling that case management is just adding more work when you're already feeling overwhelmed.
Oh, totally. We're
Yeah.
all stretched so thin already.
Right. So I think it's all about how we frame the conversation. We need to emphasize that case management isn't about adding more tasks. It's about working smarter, not harder.
It's about preventing problems instead of constantly putting out fires.
Exactly. And if you can show how case management actually saves time in the long run, because you'll have fewer readmissions, fewer complications, and better patient flow, it becomes a much easier sell.
So it's about shifting our focus from that immediate workload to the long-term benefits.
Absolutely. Another challenge is just a lack of resources, especially in smaller facilities.
And not every hospital has a whole team of case manager.
True, but even without dedicated resources, you can still make it work. It starts with education and empowerment, giving nurses the training and the tools they need to understand and apply case management.
So even something as simple as a checklist for discharge planning or a template for follow-up calls.
Exactly. Those things can make a huge difference. It's about making sure nurses feel confident and competent in providing this kind of care.
As we're talking, I'm realizing that case management really aligns with everything we stand for as nurses.
Right.
Advocacy, compassion, that holistic view of patient care.
Absolutely. It's about seeing our patients as whole people and supporting them throughout their entire journey.
And speaking of support, don't forget to check out healthcarenurses.net for all those resources we've mentioned and so much more. You'll find checklists, templates, case studies, tons of information to help you put these case management principles into action.
We're here to support you every step of the way.
Now, before we wrap up this part, I want to touch on one more crucial aspect of case management, and that is communication.
Oh yeah, communication is key. It's the foundation of effective case management. Clear, concise, and timely communication between all members of the care team.
And not just between providers, but with the patient and their family too.
Exactly. Everyone needs to be on the same page. Information needs to be shared seamlessly. And the patient needs to feel heard and understood throughout the process.
Like those multidisciplinary rounds we talked about. That's a perfect example of communication in action.
It is. Getting everyone together who's involved in the patient's care, it really fosters that collaborative approach. And it makes sure that everybody has the same information.
It prevents those siloed approaches that can lead to fragmented care.
Exactly. And it empowers every member of the team to contribute and advocate for what's best for the patient.
It strikes me that case management is all about building bridges.
That's a good way to put it.
It's bridging that gap between the hospital and the community, bridging the gap between different healthcare providers, and most importantly, bridging the gap between the healthcare system and the patient.
Well said. It's about creating a seamless experience that's supportive and truly patient-centered.
That's a vision worth fighting for. And in our final segment, we'll explore what a healthcare system that fully embraces case management could actually look like, and how we, as nurses, can lead the charge. But for now, let's just take a deep breath and really absorb everything we've talked about so far. We'll be right back. Welcome back to the Healthcare Nurses Network podcast. So in this last part of our deep dive on case management, we're going to step back a little bit from the nitty-gritty of how to do it and really look at the big picture here. What kind of transformation is possible with case management?
It's exciting to think about what a healthcare system would look like if it truly embraced case management at its core.
Right, like what would that actually look like in practice?
I think patients would finally stop feeling like just a number or a diagnosis. They would feel like a person, like someone with their own unique needs and goals.
Yeah, instead of being overwhelmed and lost in the system, they'd have someone in their corner.
Exactly. Imagine a patient who's just been diagnosed with a chronic illness. Right away, they're connected with a nurse case manager who's their advocate, their guide, someone to help them through all the ups and downs of dealing with their health.
It'd be like having your own personal healthcare expert, right?
Yeah.
Someone who really gets you and knows what you need, connects you with the right people, and helps you make good decisions about your health.
Precisely. And this nurse wouldn't just focus on the medical stuff, they'd look at the whole picture, the emotional side, the social challenges, the practical stuff that comes with having a health condition.
The whole person, not just the disease, right?
Absolutely. And I think this kind of approach benefits everyone. The patient gets better care, there are fewer complications, and in the end, the healthcare system works better and costs less.
It's a win-win all around. But let's be real for a second. How do we actually get from where we are now to that ideal system?
Well, it starts with us, with nurses. We're the ones who are with patients every day. We see firsthand the impact that case management can make.
So what can we do to make this vision happen? Where do we start?
We need to be loud and proud about case management. Talk to your colleagues, your administrators, everyone. Share the stories where it's worked, the data that shows how it helps patients and saves money.
Make the case for case management.
Exactly. We've also got to keep learning. Always be on the lookout for new information, new best practices, the latest on case management.
And we can't be afraid to try new things, even if they're small.
Right. Even a new way to do follow-up calls or getting different people involved in discharge planning can make a difference.
Every step forward, even a tiny one, gets us closer to that patient-centered system we're talking about.
And that's what makes this so rewarding.
Absolutely. It's not just about being a nurse, it's about making real change happen.
Beautifully put. And remember, you're not alone in this.
Right. Head over to healthcarenurses.net. You'll find tons of resources there, support from other nurses, and a whole community of people who want to make patient care better. Well, we've talked about a lot in this deep dive. The basics of case management, how to make it work, and even how it can change the future of healthcare. As we wrap up, I just want to leave you with one thought. Case management isn't just a to-do list. It's a way of thinking, a commitment to doing our absolute best for every single patient we see. Thanks for joining us for this episode of the Healthcare Nurses Network podcast.
Thank you for listening to the Healthcare Nurses Network podcast.